Hello everyone, my name is Dominic Webster, and today I'll be discussing Parkinson's disease, what it is, its signs and symptoms, the epidemiology and pathophysiology of the disease, its risk factors, treatment options, and more. So I'd first like to start off by defining what Parkinson's disease is, and it is defined as a neurodegenerative disorder that predominantly affects dopamine-producing neurons in the brain that impairs motor function. So one primary key note that we want to make right off the bat is that Parkinson's disease is different for each person. No one person will experience the same symptoms, the same order, maybe their level of intensity of the symptoms will vary, whether they were diagnosed early onset or later. All of these different factors affect how they deal with Parkinson's disease. Despite that, there is a typical pattern of progression in Parkinson's disease that is laid out and defined in 5 different stages, which I will later explain in detail. So now moving on to the signs and symptoms of Parkinson's disease. So as we can see to the right, some of those signs are laid out on the sketch of this man. As we can see at first, the resting and acting tremors, which pretty much means that he's always going to be shaking his fingers, hands, arms, legs, just the inability to keep still and constant tremors going on. Next, we can look at is the rigidity, primarily of the spine, trunk, and extremities, loss of range of motion, which increases their fall risk, balance issues, and more. So now, bradykinesia is the slowness or inability to rapidly move fingers, toes, hands, arms, any extremity pretty much. Just those muscles don't fire at the rate that we want them to, and with that, you have slow and rugged movement. Also, the posture, as we notice in this gentleman here, we can see that he's kyphotic, which means that he's leaning forward. It kind of looks like he's almost hunchback, and his extremities are always flexed, so that sometimes put pressure on the joints. Now, 2 other terms that I'd like to incorporate are start hesitation and abnormal gait. Those are 2 terms associated with Parkinson's disease patients that have to do with their walking. So for start hesitation, it's the inability to initiate the first step of walking. And for abnormal gait, it's they're not walking correctly. They're either slow and shuffling movement, often including dragging one or both feet, and it increases their fall risk dramatically. Now, dynamic postural instability, that just primarily leads to simple balance and posture issues, could also result in low back pain and increase their fall risk as well. As for fine motor control loss, also known as micrographia and hypomia, micrographia makes them unable to carry out certain daily livings that require fine motor function, such as the ability to cut food, handle utensils properly, have eligible handwriting even. And for hypomia, that causes them to have trouble communicating or making facial expressions, almost as if they're frozen, and the inability for those facial muscles to fire. But with all the signs and symptoms on this list, the most frustrating issue with this disease is the loss of functionality or the inability to perform certain activities of daily living. So it's like your brain knows what it wants to do, your body wants to do it, but because you don't have that right amount or the neurotransmitters aren't correctly working, you can't have that movement. And I know that me personally, whenever I'm injured and can't do a sport or can't participate in exercise, I'm so frustrated. So I couldn't even imagine having to combat this disease. Moving on to the pathophysiology of the disease, it's primarily associated with the reduction in the neurotransmitter called dopamine, and that's caused by the death of the dopaminergic cells, which reside in the part of the brain also known as the basal ganglia. So dopamine plays a significant role in sending messages to the part of the brain that controls movement and coordination. So it's so hard to diagnose Parkinson's disease because the symptoms of Parkinson's disease aren't even prevalent until about 80% of those dopaminergic cells are completely dead. So that's why it's so difficult to have a proper diagnosis of this disease. It's also associated with low levels of norepinephrine, another important neurotransmitter that controls, you know, many autonomic body functions, such as the circulation of blood, for instance. So in PD, Parkinson's disease, the nerve endings that produce the neurotransmitter they completely die. And this could possibly explain why people with PD experience fatigue, constipation, orthostatic hypertension, in addition to primarily movement problems. So orthostatic hypertension is when you get dizzy or little lightheaded after you stand up because all the blood has pooled to your legs. But obviously the primary movement problems is what is the main idea here. So if we take a look at this image here, this is actually a image from the American Journal of Neurology, and it's actually a SPECT scan. So a SPECT scan stands for Single Photon Emission Computed Tomography, and that's showing the activity level of dopamine in the brain. So what they do is they intravenously give a patient a radioactive tracer that attaches to the dopamine, and as we can see in here, this is for a healthy individual. They have a 1.6 rating, which is a very high uptake of dopamine. As for when we go to the early Parkinson's, we can see the decrease in red, which is a decrease in dopamine or uh, the dopagenic cells producing dopamine. And now, as we can see more in the advanced Parkinson's, there's barely any red and just no dopamine being produced or used. Now for diagnosis. So unlike some other diseases, there's no one objective test. There's no blood test. There's no physical test that can say that you definitely have Parkinson's. There's various symptoms that can try to be present, and in addition to tests such as the SPECT scan, um, those are how we can come up with an accurate diagnosis of Parkinson's disease. So, in order for a patient to have Parkinson's, they must have two of the four main symptoms, which are shaking or tremor, slowness of movement called bradykinesia, which we discussed, stiffness or rigidity of the arms, legs, or trunk, and trouble with balance, possible falls, also known as postural instability. Um, uh, like we said, in addition to the recognition of these symptoms, we can have the SPECT scan to see the dopamine activity, which we saw on the previous slide. So as for risk factors, because there's no known cause of Parkinson's disease, there's really no scientifically validated course to reduce the risk. For the risks that have been identified, they're all non-modifiable. It's gender, age, race, and genetic factors. So there's really nothing that you can do to change that. For gender, it's 1.5 more times prevalent that you will have Parkinson's disease if you are a man than a woman. As for age, the older you get, the greater the chance for developing Parkinson's disease. For race, several studies have shown that Parkinson's disease is more common in whites than African Americans or Asians. It's estimated the prevalence of this is 50% lower in blacks and Asians than in whites. However, the highest incident of PD is found in Hispanics, then by non-Hispanics, whites, Asians, and African Americans. Finally, genetics. Approximately 15% of people with PD have a relative with the disease. So if your grandmother, aunt, mom, dad had PD before, you have a 15% chance of more likely to have PD. However, scientific studies have found factors associated with greater or lesser risk of PD. So some of these studies have shown that smoking and caffeine, unbelievably, uh, associate you with lower risk of developing Parkinson's disease, whereas head injury and pesticide exposure have been associated with a higher risk. So these studies do not definitely link factors that will either heighten or lessen your risk of developing Parkinson's disease, but it does highlight areas where further research may guide us to risk prevention and treatment strategies. So now, moving on, we'll talk about the stages of the Parkinson's disease. So looking at this chart to the left here, we can see that it has 5 various stages. So in the first 2 stages, also known as early Parkinson's disease, we have the symptoms are mild, and the difference between stage 1 and stage 2 is that stage 1 is unilateral, which means that's only on one side of the body, and stage 2 is bilateral, which means that it's on both sides of the body. That includes tremors, rigidity, um, not moving the muscles correctly, and the inability to start to walk properly. Now, once we get into stage 3, that's when everything pretty much takes a turn for the worst. That's the mid stage. For the symptoms, they now become moderate, and now we're affecting the primary balance and walking ability. And this is where people start to notice sufficient functionality loss. Now, moving on to the latter stages of stage 4 and stage 5, also known as advanced PD, um, the patient struggles profusely with movement. The difference between stage 4 and stage 5 is that stage 4, they can still move, whether that be with assistance or without. They do obviously have a great risk of fall and can become incapacitated. And in 5, they're completely incapacitated. They cannot move. And it also has the higher risk of them developing Alzheimer's. So symptoms like hallucinations or memory loss can be seen at stage 5 of this. So now, moving on, we're going to talk about the epidemiology of Parkinson's disease. So in this graph, it represents the Parkinson's cases in the United States in accordance to age. So as we can see, the prevalence of cases here, it follows a positive linear correlation with age. So as you get older, you have a greater chance of developing Parkinson's. The data backs up this risk factor that age, meaning that the older you are, the more likely you are to have develop or have Parkinson's. Further on, nearly 1 million people will be living in Parkinson's disease in the U.S. by 2020, which is a little scary. That is the more than the combined number of people diagnosed with multiple sclerosis, muscular dystrophy, and Lou Gehrig's disease. So currently, there are more than 10 million people worldwide living with Parkinson's disease. And every year, about 60,000 Americans are diagnosed with Parkinson's disease. This doesn't include the thousands of cases that go undetected, like we said, because it is so difficult to have an accurate diagnosis of this disease. Finally, the combined healthcare costs of Parkinson's, including treatment, Social Security payments, and lost income, estimates nearly $25 billion per year in the United States alone. So that's a huge, huge factor in thinking about our healthcare and our economy. So now moving on, we have the treatment options. So there's three main categories for it. The first is medication, and for medication, you have to look at each individual. You have to evaluate them individually because not all the combinations of medication is going to work best for one patient than it does for another. For some, it might be a dopaminergic aid like levodopa, which increases dopamine levels. For others, it might be antiviral, which increases presynaptic release of dopamine, or anticholinergic, which increases the breakdown of acetylcholine. So it just varies from patient to patient what works for them. As for exercise, for people with Parkinson's disease, exercise is more than healthy. It's completely vital. It's the main component to maintaining balance, mobility, and activities of daily living. Exercise and physical activity can improve Parkinson's disease symptoms. Sorry. These benefits are supported by so much research, and the main focus is that we want to focus on the stability, flexibility exercises to maintain full range of motion and help with the balance issues. A great example of the exercise is a rock steady boxing. This works on optimal agility, speed, muscular endurance, accuracy, hand-eye coordination, footwork, overall strength, and it is supported by the notion that rigorous exercise emphasizing gross motor movement, balance, core strength, and rhythm could favorably impact range of motion, flexibility, posture, gait, activities of daily living, all of the various things that patients with Parkinson's disease struggle with. So for some reason, the constant switch between offensive, defensive positions, and all the movements engaged in boxing excite the neurons of the brain more than any type of exercise, which is why it is such a great exercise to do for those with Parkinson's disease. Um,